As an organization, we've been heavily focused on becoming more data-driven over the last 2 or 3 years. Our capabilities in analytics and business intelligence have really matured in those timeframes. And what we're really working toward is continuing to look at how we normalize and standardize our data so that we can compare both internally as well as to our national peers. Data is critical for us as we move into kind of addressing some of the changes in healthcare. In the past, we likely haven't had the information we need to make decisions, both at the bedside as well as to understand our operations in the right way. And data really allows us, again, to understand our current performance and understand the levers we need to pull to be successful going forward. Our relationship with iVantage is really going to accelerate and help us approach this work in a different way, really primarily because they do allow us to benchmark against our peers, and they start by helping us standardize our data into kind of a normal framework so we can be consistent in that comparison. Kind of remove the noise actually from the comparison. If all we ever do is sort of think about how we've done things in the past, we may not be actually as efficient as we could be. So benchmarking is really valuable for us, both internally across the organization. So we have 9 large regions. I think there's a lot of value in us benchmarking there, but to do that, we have to have a standard kind of collection of and normalization of our information and the underlying data. And then there's an opportunity for us to look outside the organization and understand how we can really be best practice with some of those large integrated health systems that are our peer groups. We're really excited to get started with this work with iVantage. It is a next step in maturing our analytics capabilities as well as our transition into being a much more data-driven organization. With data and with the right operational structures, we'll provide the best care for our patients.